afternoon, everyone. My name is Haley McCullough, and I'm an ORISE Fellow appointed to CDC's Center for Preparedness and Response, Division of Emergency Operations. Thank you for joining us for today's EPIC webinar titled, The Role of Congregations in Public Health Emergencies. Today, we will hear from Peter Gudaitis. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education by completing this webinar. Instructions on how to earn continuing education can be found on our website, emergency.cdc.gov/EPIC. The course access code is EPIC0123 with all letters capitalized. To repeat, the course access code to receive continuing education is, in all caps, EPIC0123. Today's webinar is interactive. To make your comments, click the chat button on your screen and then enter your thoughts. To ask a question, please use the Q&A button. The Q&A session will begin after our presenter has presented. Closed captions are also available for this webinar. Details on how to view them are on the screen and in the chat box. We are very fortunate to have Peter Gudaitis as our speaker today. Peter is the president of the National Disaster Interfaiths Network and the executive director of the New York Disaster Interfaith Services. He has over 30 years of experience in chaplaincy, disaster emergency management, faith-based philanthropy, program management, and social services administration. His experience also includes almost a decade in emergency medical services. Additionally, Peter has received many local and national honors and appointments. In 2018, he was appointed to the New York State Puerto Rico Recovery and Reconstruction Committee by Governor Cuomo. Thank you for joining us today, Peter. Please begin.
Thanks for having me. Just so everyone is aware, some of the slides in this deck were written by NDIN and the USC Center for Religion and Civic Culture for the Department of Homeland Security's Emergency Management Institute, and they offer some of this information in an online course called FEMA IS 505 Individual Study 505, which you can take online for free by just Googling FEMA IS 505. Slide. We're going to be talking about faith communities in the broader context of how they fit into communities as a whole, which has been an emphasis of FEMA now going back 10 years, to how we look at faith communities as partners with government and the private sector in building resilience and also responding to crises around the country. Slide. We want to emphasize that communities cannot truly achieve resilience without figuring out how to integrate faith sector preparedness and response capabilities into interacting with the human services and government sectors. That we continue to look at how we explore partnerships between these sectors rather than operating in silos. Slide. So resilience from our perspective and from this, I think using the language of emergency management, is about how we can equip communities to bounce back, if you will, more quickly from adversity. And your resilience factor is based on how quickly you can return to some semblance of normal function and sustainability. And the longer that takes, obviously, the more truncated recovery becomes and how individual people can kind of fall out of being serviced, being supported. So emphasizing that faith communities play a role in that, we want to make sure that faith communities are never left out of that conversation, but they're always a part of it, always, if you will, at the table to ensure the whole community, if you will, it remains resilient. Slide. So when we're talking about the assets faith communities bring, it's certainly something that we need to be aware of across faith communities, but also with our nonprofit sector partners. As many of you know, that falls under VOAD, typically in the United States, Voluntary Organizations Active in Disaster, which we're going to talk about later. But to understand what faith communities bring to partnership, we have to focus on more than just congregations. Their understanding of service that they will serve. The question is, will they serve in a skilled and collaborative, coordinated way, or will they simply serve on their own? Faith communities are typically trusted and have moral authority and legitimacy as partners. They're well-resourced as a whole, space, people, money, logistics. They have intimate knowledge of communities and are the perfect partners in building networks and partnerships, as well as connecting federal partners and national emergencies to local communities. They're well networked. They offer many types of programs, not just worship, but also human services, volunteers, fundraising, equipment, and many other skill sets. They also have staying power, equipping them early in the response, make sure that there's competent leaders for long-term recovery long after many other groups have left. Slide. So for this presentation, I just want to be clear what we mean by literacy versus competency. Literacy, for lack of a better sophisticated way of putting it, is the stuff of religion, what people believe, how they worship, what they wear, what they eat. And competency is how we navigate those things. How do we understand the rituals, beliefs, and burial customs or eating practices of unique populations so that we can better support them in times of crisis or equip them to support themselves. Slide. So this isn't sort of political correctness. I mean, I understand how some people think that at some level. However, this really is about skills for actually completing our mission assignments. So how do we understand culture and religion? How does that affect how people recover, how they understand mental health services, medical interventions? How do they understand preparedness? How do they understand vaccines and how they work? All of these things are about building trust and building our ability to work more effectively. Slide. These are a set of resources that I would just want general awareness around. FEMA IOS 505, which we've already discussed, which is free online, 3 hours. You get a certificate if you're into hanging certificates in your office. Slide. Within that curriculum, there are these 3 tip sheets that we wrote for FEMA EMI. One on how you engage with communities, develop a plan for that engagement, cultural competency, uniquely distinct from religious competency, and a quick reference guide on other resources and tools. Slide. These are 2-page tip sheets on how each of these faith communities is structured, how they're led at the regional level and local level, so who are the best outreach points of contact, how they're led in terms of lay or ordained leadership, what the best approach is, and what are unique attributions of those faith communities that we should be aware of before approaching them. For instance, not trying to do outreach to synagogues, for instance, on Fridays in the afternoon because the Sabbath is approaching and people are focused on that, which runs through Saturday evening. So, Sunday perhaps is a better weekend day to work on engagement in the Jewish community. Next slide. This is also a resource that FEMA published this year, last year, 2018, on better engagement strategies and best practices, methodologies for emergency managers, which of course includes public health officials, and several of the resources that I'm talking about are also listed in this guide, but it's also free. You can download it online on FEMA's website. Slide. These are two other resources, a field guide for doing better faith-based engagement between government and the faith sector, with an emphasis on how the government can do better at those things, but it's certainly applicable to different faith communities and how they work with one another. The primer is a literacy primer, so it talks about over 2 or 3 pages per movement per faith tradition, what unique things someone in emergency management or public health might need to know about working with a faith community in a time of crisis, including burial practice, eating practices, prohibitions against medicine, medical interventions, mental health care, physical touch between people, that sort of thing. Slide. That resource and the rest are available for free on our website. This is the website, www.n-din.org. There's also 26 tip sheets on these topics, as well as some tip sheets provided by other best practices partners. The 2 most popular that we have are active shooter in a house of worship and working with children in disasters, but there's a variety of other topics. All of these tip sheets were written based on feedback from clergy following 9/11 and Katrina for topics that they felt like they'd wished they'd known more about prior to the disaster. So this is about building skills of leaders in faith communities, both lay and ordained, to make sure that they have a basic understanding of life cycle services and prevention. Slide. Slide. These are 5 tip sheets on faith communities that have unique dietary, dress, physical touch, sheltering needs. They have been co-branded with the American Red Cross, which shares them with their shelters around the country, but they're a great resource in terms of particularly working at mass care, so feeding and sheltering. Slide. This is a curriculum, and there are others. This was written for a multi-faith audience. There are faith tradition specific curricula that all should focus, if they're competent, on an understanding of mental health first aid, psychological first aid, spiritual care interventions, and the operations of working as a disaster chaplain in the field, not proselytizing in mass care settings, which would violate national VOAD points of consensus, making sure that providers understand that they are there to provide emotional and spiritual care to people of all faith traditions or none. Slide. This is another great resource written specifically for religious professionals and how they understand and practice psychological first aid. I certainly encourage folks to take a look and use that as a resource. This was produced by Health and Human Services, but with a lot of trusted community-based partners. Slide. And this is the last resource. This is a great book. I received no royalties for pushing it, on a basic understanding of the role that religion has played in U.S. culture, society, and history, as well as unique attributions of different faith communities that all Americans should have a basic understanding of. Unfortunately, we are one of the most religiously diverse countries in the world, but we lack instruction in basic comparative religion in public education. So most Americans, unless they choose to take these studies on in college, do not have an academic or historical understanding of faith traditions other than their own, if they even understand their own very well without a more formal educational exposure at the congregational level. So this is something we need to work on if we're going to build better competency in our society and government. Slide. Next slide. So about 83% of Americans, that number has dropped a little bit over the past few years, are affiliated with a specific religious tradition. By specific, I mean they don't just say they're Christian, but they say they are Presbyterian or Mennonite or Shia Muslim or True Land Buddhist. There are approximately 345,000 houses of worship in the United States. Comparing that with schools, they are ubiquitous. They are everywhere in every community. They are the most easily accessed public building in any community. About 60% of Americans report first to their religious leader for advice or children after a disaster. This is a study called the ripple effect. And about 40% of Americans overall, that means religious and non-religious Americans, which are called in academic parlance nuns, N-O-N-E-S, say they trust clergy as a whole. That might seem like a low number, but it's actually very high. It's one of the top 5 in terms of the kinds of leaders that people turn to for advice. Slide. So since the 1960s, the religious landscape has changed dramatically in the United States from the Immigration Act of 1965, basically the resettlement that began after the Korean and Vietnam Wars of bringing resettled refugee populations into the country. This has brought enormous change in social, cultural, and ethnic and linguistic diversity in the United States. But also let's remember what our indigenous cultures and languages are, certainly since the United States was partially French, partially Spanish, partially English and Dutch in the colonial era. Spanish is indigenous to parts of the country, all native languages, of course, English in the Northeast, and French, which has adapted into Creole in parts of the South, all have, roots, if you will, over centuries in our country. And that diversity exists both at the rural and urban setting. It's a mistake to think that diversity only exists in big cities. It's simply untrue. Diversity, however, is complex, and it makes serving communities more challenging. And although we're going to talk about some national trends in religious diversity, we also have to remember to look at local cultural context. We are the most religiously observant industrialized country in the world by far. The next is England, and we're 3 times more observant than they are. Next slide. So this is a look at how that changes over time also. So we saw that about 83% of Americans are religiously observant, but generationally that's shifting. So 40% of people between 18 and 30 are not religious adherents. So the implications is this is shifting dramatically in our society. So when we look at how we engage faith-based organizations and also how we resource them and what role they play in organizations or networks like National VOAD, we have to look at some of these downward trends and upward trends to help our partners figure out where they need to build capacity and build volunteers. For instance, it would be a mistake for white evangelical organizations to continue relying on retirees without looking at how to raise a youth volunteer corps as well, because that's a demographic that falls off quickly for them within the next 10 or 20 years. So there's huge increases in communities of color that are observant. So Hispanic Catholic growth is significant. Black Protestant growth has remained the same. White Catholic and white evangelical and white mainline Protestant denominations have shrunk dramatically and continue to do so generationally. Next slide. So as I said before, about 200 faith traditions practice here. About 70% of our country identifies as Christian with a 40% adherence rate. So that's 1 or more times a month going to worship. About 6% of our population is not Christian. So that would, the largest is Jewish, which at about 2%, and Islam is about 1%, and it goes down from there. But we also have to measure that against culture and location. So New York City, even though 1% of the US population is Muslim, it's about 10% of New York City, about 15% of New York City is Jewish. And culture matters on the other spectrum because we also have to be careful about stereotypes. So about 70% of all Arabs in the United States, for instance, are Christian versus Muslim. Most Muslims in the United States are South Asian in extract. So about 27% of our population are nuns, non-observant, and that is highest in the Northeast and Northwest. And of course, we can't forget our indigenous population, about 1.7 million Native Americans from 567 tribes. Most of those folks practice some combination of Christian faith traditions, as well as some infusion of indigenous spirituality, although there are many that, of course, practice no faith tradition or solely their indigenous traditions. Slide. This is adherence rates by major faith traditions. So when you think about how frequently congregations are in worship, that also informs how we do outreach as well. So if only about 18% of Buddhists attend worship once a week, it feels like a very low adherence rate, but Buddhists worship differently and at different times and for different reasons than weekly worshipers who just attend on Saturday or Sunday services. Jehovah's Witnesses have an extraordinarily high adherence rate. 96% are in church at least twice a month or more, and in some denominations there are consequences for not participating in worship, like losing your membership. Slide. 90% of Americans' congregations are small, about 75 participants, but most Americans worship in large houses of worship. So those are about 10% of our congregations have 350 participants or more. But the average congregation in the United States is about 75 participants. That's individuals, not households. So it could be as low as 25 households. Slide. We have shifted dramatically in this country. We are a driving, commuting culture. We're no longer a society where people live, work, and worship in the same town or neighborhood, the way we sort of traditionally understand how our communities are structured. That, of course, is less true in rural areas, but certainly in metropolitan areas and densely populated communities near major roads, highways, things like that, we tend to live, worship, and work in different communities. The reason that's important is because a community can have a priority around a certain public health issue, and they're only hearing about it at work and not necessarily where they live or where they worship. So making sure we have concentral circuits of outreach in greater communities is important to make sure people are getting properly educated, informed about threats, hazards, and building resilience or preparedness. Slide. This is a map of the United States showing the second largest tradition by religion by state. In the United States, Christianity is the predominant religion in every state, but these are the second. Pink, Judaism; green, Islam; saffron or yellow, Buddhism; Hindu, that sort of brownish color that Arizona is, and South Carolina being Baha'i, the only state. This trend is moving toward Islam. It's the most rapidly growing religion in the United States. But again, in context, just 1% of the population. The next slide, and we'll flip back and forth once or twice, looks at what that means at the county level. So at the county level, we see an enormous amount of unreportable rates of adherence other than Christianity. Those would be the gray and yellow beige. And if we look back at Arizona, see Phoenix here is where the tipping point for Hinduism is in the whole state. So it's being influenced by one county. Okay, taking a look at that. Moving forward. Next slide. This is a map of the United States. This is US Census data showing what percentage of the population speaks a language other than English at home. The reason I'm putting this up is because language is also an indicator of religious practice. So if the language in Texas is Spanish primarily, we know that the Spanish population is insignificant numbers amongst Pentecostal and Roman Catholic congregations in particular. So if we're looking for Spanish competency, looking for faith-based partners to do outreach, that can inform a better outreach plan, a more effective outreach plan. It also shows us where the density of immigrant and new immigrant refugee populations are. But also language practice is changing. And when my grandparents came to the United States, you didn't speak your native language anymore, you only learned English. Today, it's felt in many quarters, of course, that it's important to maintain language competency. It's great for your education and career potential. So people do remain culturally intact, perhaps longer than they used to. And older generations sometimes never gain the language competency in English that they might hope for. And so how we do outreach is about how we understand what this kind of demographic means for us and how it informs the community, the faith communities that we want to engage with. Next slide. This is the most common country of origin of legal immigrants, other than Mexico. That is not to suggest that undocumented immigrants are all from Mexico, of course, because that's not true. But this also plays into understanding how language is working. If Tagalog, the Philippine language, primary Philippine language in California, might speak to why 40% or so of Californians are still speaking their indigenous language at home. Next slide. This is just a slide to show you kind of average in the United States. These statistics trend along the norms for the whole country. Nebraska is a little bit low on minority faith communities, numerical minority, not ethnic or racial minority, since about 6% of our overall population is non-Christian. In Nebraska, it's 4%, but in general, Nebraska trends along those normal lines. Slide. It's critical that faith leaders, because they're turned to for leadership in times of crisis, have a basic understanding of the disaster life cycle. So what roles can we play as faith leaders, faith community organizations, in making sure that we're working on mitigation or prevention, preparing our communities to respond to events, how that response goes and what roles we should have in that response, and that we understand the trajectory of recovery and that it can sometimes be many, many years as opposed to a few months and kind of losing steam. So it's worth talking about this because part of what congregations throughout the United States do routinely is focus on things that undermine resilience: hunger, poverty, literacy, social justice, homelessness, AIDS ministries, youth ministries. These are all populations that traditionally can be at risk, but if they're better equipped, more literate, more financially solvent, if they have secure housing, they're more likely to be resilient. So helping congregations understand that what they do day in and day out is already building a more resilient community and country, but partnering with them can make that more effective, building their skills towards these goals and helping them understand that it's not just literacy that they're helping with, but they're helping with overall community resilience as a whole. Slide. So the roles of faith communities. Traditionally, our sweet spot, of course, is comfort and hope. Through worship, through spiritual care, through mental health assessment and referral, through basic supportive families, congregations frequently are places that are turned to for comfort, to reconnecting with community, to feeling supported, to feeling like they understand the crisis that they've been through, to be guided morally, spiritually, and practically. But when we're affected by a crisis and you throw trauma into the mix, it is important that faith leaders, lay and ordained, build skills around mental health assessment and referral, psychological first aid, crisis chaplaincy, because those are unique taught skill sets. They're not something innate. Ordination in and of itself does not make you a better caregiver. So these are unique skill sets. They need to be thought of as unique skill sets, and we need to encourage people to do more training in these areas if they're in leadership or pastoral care roles in congregations. Prayer worship, services, events, these are things that help define sacred space and time. They help people reestablish connections to community networks of support, places where there's social capital. So getting worship and prayer may not be something the government can fund in recovery, but people who are connected to worship and prayer life, community life, tend to be more resilient, tend to recover from adversity more quickly. So emphasizing a connection to prayer life, worship life, community kinds of involvements do foster resilience. The primary role of religious leaders in disasters, and I think in preparedness, is to help communities find meaning and purpose, and to learn that these are important things for them to focus on. If congregations and their faith leaders never talk about the importance of disaster preparedness, go kits, and evacuation plan, preparedness for pandemic, safe practices around not spreading the flu at events, these are the kind of things that not only jeopardize the health and wellness of congregations and their staff, but they contribute to a lack of community wellness as well. Slide. So, working with partners to offer community-based worship services, healing events, marking the anniversaries of crises, of school shootings, terrorist attacks, major apartment fires. All of these things are a comfortable role, and they offer the example that government and the private sector, faith communities are working together to support those that are impacted. Justice and healing, having a voice in the community, making sure that no community is left behind, but also emphasizing the fact that often it is simply our presence that brings meaning to people and comfort. A ministry of presence is often about being a good listener and not about being a talker and a fixer. So making sure that folks understand caregiving is sometimes about presence and physically helping, and not necessarily about what they have to say. Using connections with politicians and community leaders is important because it brings expertise to the community. It offers culture and religious guidance to improve the services being provided, particularly in high-stress situations like mass illness or mass fatality incidents, and promoting the curtailing of bias crimes or bias that sometimes crops up after disasters. Slide. So when you're thinking about outreach with faith communities, think about what their religious obligations are. Doing outreach to a Sikh house of worship to ask them to do commodities distribution is not necessarily speaking to their skill set. Sikh houses of worship all typically have a langar hall, a feeding hall, and part of their understanding of their faith tradition is they have an obligation to feed the poor. So they're a good partner for feeding ministries, not necessarily other things. Look at what they have expertise at. If they're already a shelter, if they're already a food bank, a food pantry, a soup kitchen, build on those skills rather than asking them to shift mission. Understand what their faith traditions, national VOAD organizations have an expertise in. For instance, Catholic Charities USA has a significant amount of expertise in disaster case management. So understanding that partnering with Catholic congregations can also help bring skilled disaster case management to a community, the Mennonite community in rebuilding, or Islamic Relief USA in rebuilding, Tzu Chi Foundation in terms of volunteers. That understanding between local and national brings additional layers of training, skill, and financial support to communities and connects to local congregations. Who's making the ask matters too. If a community has traditionally had a strained relationship with law enforcement, maybe law enforcement isn't the best outreach option, and maybe public health might be. One-offs versus sustainability. Enormous amount of complaints all across the country from faith-based organizations who feel like government agencies and nonprofit partners do one-offs to engage faith communities and then don't follow up on the relationships. So that's something that I think we should discourage. It's often about, you know, having to spend down money to do a specific thing to tick a box in a grant or federal funding, and trying to work with our funders, help our federal partners, local government, local philanthropy, understand that one-offs are not helpful. Building and sustaining relationships is our goals. Is our goal. Congregations live in the relational ministry footprint. They're not terribly invested in one-off engagement or education events. Slide. Basic understanding of the National VOAD movement, which we talked about. It is a national movement based out of the Metro DC area. There's a chapter in every state in the country, and there's well over 1,000 local COADs or VOADs throughout communities in the United States. They are the ideal partner for congregations and local faith-based organizations to skill build, learn best practices, and maintain relationships with one another and their government partners in public health and emergency management. Slide. Yeah, all these things you can read after the fact, but they bring an enormous amount of competency, if you will, to our response. Slide. They do have points of consensus and national standards, a lot of toolkits and resources that can be shared with communities. I just gave the example here of the category of emotional spiritual care, which is a term, a turn of phrase also, ESC, disaster spiritual care, and the discipline of disasters. How do you provide disaster spiritual care in a competent way? Ideal resource is National VOAD's publication, Light Our Way, a quick reference guide, just recently republished. It's downloadable for free on the National VOAD website. And also understanding that emotional care often is a bidisciplinary approach with spiritual care, because as a deeply religious country, most Americans have a spiritual grounding as well as a mental health grounding, and making sure that they work in a complementary way together is the best way to help folks be resilient or recover from the experience of traumatic events. Slide. That's the end of my presentation. Happy to answer any questions. Again, all the resources we talked about are free on the Department of Homeland Security's FEMA website, or NDIN's website, n-din.org. Right on our homepage, there are links to download all of those resources for free.
Thank you very much, Peter, for that wonderful presentation. We'll now transition to our Q&A session. Jonathan, can you read the first question?
I can. This question comes in from Hani Al-Malki. Hani asks, are there validated indicators that measure the faith-based community engagement and its impact on community resilience at the time of emergencies or disasters?
I am not aware of any specific study long-term that looks at the role that faith-based organizations play in resilience, but I am sure there are academic experts like Jamie Ayton from the Humanitarian Disaster Institute that may have published on this, so I would refer you to them.
Thank you, Peter. The next question is from Stephen, and this question says, I understand the role of National VOAD and VOAD, but if I am a pastor of a local church that would like to become involved in local disaster response. What is the best pathway to do so? How would you recommend going about building faith/government partnerships?
I mean, I do think that local health departments and emergency management agencies are the best point of contact for congregations at the community level. So having a relationship with, typically they're at the county level, except for big cities. Medical Reserve Corps, Citizen Corps Council, CERT teams, local disaster chaplaincy teams. Most Red Cross chapters in the United States have some sort of opportunity for clergy to serve as crisis or disaster chaplains. Fire departments and police departments are often looking for police and fire chaplains, but general preparedness for congregations and bringing that training in would definitely be, I think, best through connecting through a county health department or emergency management agency.
Peter, a quick follow-up on that. In your experience, is it advisable for a congregation to form some kind of disaster response council within their congregation?
Yeah, look, I mean, if we think about 90% of the congregations in the country have less than 75 adherents, right, participants, we're talking for the most part about small congregations. I would say appointing one or two people in a congregation to look at that congregation's disaster plan, emergency communications plan, insurance policies, how the congregation might preserve vital information and statistics. All of those things are certainly something I would strongly encourage for every organization in the United States, not just congregations, but certainly for congregations. I think for larger congregations that have hundreds of adherents, something like a committee may be more effective. But I would want to emphasize looking at the entire life cycle, so not just preparedness, but how the congregation might respond, and looking at what essential partners exist outside of the congregations. You can't do preparedness well without best practices and strong curricula, which you're going to get from public health offices at the county or city level, emergency management partners, and then all the things that are available through national tools and resources as well, and all the webinars that we talked about that are offered for free by the Emergency Management Institute.
Okay, thank you. The next question is from Hani Al-Malki again. What are the main challenges that congregations might face in disaster preparedness and response?
Just like the average household, not being properly insured, not looking at where they are in relationship to the floodplain, not having good health safety measures in place, like making sure that people are social distancing if they're sick and coughing into their elbows, they understand to wash their hands. Everything that we experience in school or in the workplace, all things that are important to general hygiene and public health safety. But uniquely in congregations, there's much more intimacy and touching and the sharing of communal meals than there necessarily are in any other place other than the home. So I do think these practices are essential to our communal life as people of faith, as well as where we work and live.
Scott Howard asks, in Arkansas, the Presbyterian Disaster Preparedness and Response Committee has a PowerPoint presentation that is offered to congregations, but there is very little interest in this presentation. How do you motivate congregations to engage in preparedness and mitigation planning when there is little interest? It never happens here, response.
Yeah, you're preaching to the choir. One of the most complicated questions for emergency management organizations in government and in the VOAD sector is how to change our cultural understanding of the importance of preparedness. When we look at the seatbelt safety campaigns and Stop, Drop, and Roll and Smokey the Bear and the kinds of prevention education that did take root in the country. We haven't found the magic yet, I think, for disaster preparedness. Typically, unless you've lived through a disaster, it's not something that you can engage with easily. I will simply say that we should think of disasters in a very broad context to make it relevant to daily life and not simply focus on big things like 9/11, Katrina, Maria, and Harvey, because the big happens infrequently. But there are school shootings, there are public health outbreaks, there are large fires and industrial accidents in communities all the time. We need to focus on the routine challenges that people face, like house fires and house of worship fires, as well as the loss of leadership in congregations, as a way of looking at how we do continuity of operations planning or risk communication or emergency communication as something that we need for day in and day out competency building at the congregational level, and not just think of disaster preparedness as something for unique for a unique point in time that you hope will never come, because it will come for everybody in every community many times in their life. The question is, are we thinking of it that way, or are we just thinking it's only a disaster when it's tens of thousands of people in many states?
This question comes from Seward. Under what emergency circumstances do congregations tend to be more insular or more embracing towards outsiders? Are there studies that have examined the effect of crises on interfaith collaboration?
There actually are, and many of them came out of Katrina. And they sometimes are looking at unique populations like the African American community and how it was affected by perceived racism following Hurricane Katrina. We've looked at the roles. The Department of Homeland Security, FEMA, did a study specifically on the role that faith communities played in the response to Katrina. That's still, I think, relevant today. There's many, many others, but I think it is important for us to understand that faith-based organizations, congregations, typically will respond whether they are trained or skilled to or not, whether they are well networked or not. So part of this is about making sure that if we respond as faith-based organizations, we do it well and competently, and not just out of compassion and have to say to people, we did the best we can, but we actually did the best. But it's also an understanding, I think, on the part of our partners in government that working with us collaboratively is also essential to making sure these things are done competently.
This question comes from Sarah B. Where do the faith-based leaders typically get training in the psychological/mental aspects of post-disaster support to their congregations?
So many national VOAD member organizations, faith-based and secular, offer free mental health first aid, psychological first aid, disaster chaplaincy types of trainings. Red Cross chapters throughout the United States offer these trainings. A lot of health departments in the United States offer mental health first aid. So I think it's often a matter of learning who's available locally, because I think it's probably being provided in many different quarters. The question is, do we know who they are? And do we trust those institutions as organizations that we would invite into our congregations to teach? I think it's really important, however, to understand that for the most part, we're teaching non-sectarian skills here, right? There's no such thing as Christian mental health first aid. There's just mental health first aid. It's for everybody, anybody, whether they're Christian, not Christian, or of no faith at all. So we limit ourselves by sometimes thinking that we have to be trained only by somebody within our faith tradition because we do things uniquely. We don't. All of these things are done on common national best practices. Our perspective on them might be informed by our individual theology and practice. But looking to organizations that are nationally accredited versus somebody that just hung out in a shingle and said, I'm good at this. So you don't want somebody teaching you about trauma who doesn't have expertise in trauma. just because they're a family therapist doesn't mean they know anything about working with someone who's been a victim of trauma.
I would also like to point out that we actually held a webinar on this topic a couple years or so ago. If you go to the CDC EPIC website, you should be able to find it there. And our guest presenter, we had two guest presenters. One of them was Kevin Ellers from, at the time, Salvation Army.
Yeah, Kevin's definitely a well-known national expert.
So let's see, we got a comment here from Grace Kelly McGovern. Our county has a division that works with faith-based communities. We include the Director of Religious Affairs in our outreach. We also have an Office of Minority Health. Would you recommend that the Health Department PIO also create a distribution list of houses of worship and reach out to them?
Yes. Yeah, I think this is happening around the country in many different areas, and obviously the CDC is doing it, or this wouldn't be happening. But emphasizing that clergy are essential as a risk communication network, just, full stop. But they're also effective partners in education and advocacy. So they are the perfect PIO, public information officer, disseminators of information, and the more skilled and trained they are, the more effective they can be in educating congregations in addition to just helping share communication.
Thank you. And now we have a couple questions here that might be better for follow-up on EPIC. But I'm going to follow up with a question from Anthony Ravey. Have you an interface with UN organizations? For example, my former organization, UNICEF, where I was an emergency specialist for 20-odd years and is now retired, is headquartered in New York City. And in general, if we can just generalize that question to how does this apply to an international context?
I obviously think anybody anywhere in the world is affected by local religious adherence rates, practices, culture, laws. And so all governments in this country and around the world should look at ways to work in collaboration with faith leaders as a way of building national resilience and sharing local best practices and expertise around humanitarian crises. We are lucky in many ways in the United States that we aren't mired in violent ethnic and religious conflict, which obviously is a much more complicating factor to working in faith communities. But we also frequently have international visitors. I know here in our office regularly throughout the year that can come and see what opportunities there are and models there are for faith communities to work peacefully and collaboratively together that may not be happening in other quarters of the world. Religion, unfortunately, is a causal factor of violence in many places in the world, but it also should and must become a method of justice and peace, and that justice and peace is just as important for resilience as all these other practical skills around disaster preparedness for me. But I do think this is being done in Europe in some places. I know that because I get phone calls from folks there. There's a massive national clergy collaboration effort in Australia across the whole country. So I know some of this work is being done in other countries. It's certainly being done to our north in Canada, where we also get a lot of questions and collaboration from. And again, some of the international aid organizations like Church World Service, UMCOR, Catholic World Relief, I'm sure they have more knowledge than I do about how to make more change in this area.
Okay, and one last question before we close. Carlos Ciordia asked, are there any financial incentives for religious organizations to engage in emergency preparedness?
I'm going to throw my government partners under the bus a little bit here. The answer is yes, but the question is whether or not local counties choose to use their money that way. So, for instance, my organization here in New York Disaster Interfaiths Services, we get $75,000 a year in funding from our health department to help fund the faith sector community preparedness program, which is to build resilience in faith communities across the city. And that's federal funding through the city that we are given. They also make a grant to the human services sector, housing sector, and some other sectors as well. But yes, but it's a local choice. I'm sure it depends on the resources local counties have at the health department or emergency management agency, and whether or not they believe that it would make effective change. And I think local clergy, if they were well networked, could advocate more effectively for why they should get that kind of funding. And they'd have to prove that they're going to actually be an effective partner, and they're going to be able to achieve measurable indicators that they are building resilience. I mean, if we want government money, we have to recognize there's accountability for how we use it and making sure that it's effectively used.
And Haley, that's all the questions we have time for.
Thank you very much, everyone, for your participation in the Q&A session. And thank you, Peter, for your wonderful presentation.
My pleasure. Thank you.
As a reminder, today's presentation has been recorded, and you can earn continuing education units for your participation. Please follow the instructions found on emergency.cdc.gov/EPIC. The course access code is EPIC0123 with all letters capitalized. Also, if you have any additional questions, you may email them to epic@cdc.gov. Thanks again, everyone. Goodbye.
Goodbye.